The World Health Organization recently declared Liberia Ebola-free after 42 days without a laboratory-confirmed case of the deadly virus. Liberia was first declared Ebola-free in May, but a new case in the month of June reversed that status as authorities continued to monitor the situation. Tolbert Nyeswa is the Deputy Minister of Health in Liberia. He's also head of Liberia's Incident Management System, in charge of coordinating efforts to fight the deadly virus. He says that gaining the Ebola-free status is attributed to collective efforts between the government, people, and the international community.
This time we've gained knowledge, experience, resiliency as a people, and we were able to turn the tide very quickly with the two cases that occurred, the March 20th case and the June 29th case 2015. We were able to mobilize our team, the community that got affected, the Needlewind community in Magibi County and the Magibi people. Everybody in Liberia, I'm thinking, and know very well now, is sensitized to know what to do in terms of contact tracing, social mobilization, community support.
As of early September this year, 2 incubation periods have passed and no new cases have occurred in Liberia. Nyeswa says that the health system in Liberia continues to take precautions to prevent transmission in the country.
A collective effort, the international support, running the ETUs, the laboratory system, the community support, the psychosocial epidemiology team, contact tracers, barrier teams, community-based initiative groups. So it's a combination. You cannot associate that one aspect break the back of the disease. It was a combination of issues.
Figures show that almost 5,000 Liberians have died from Ebola since the outbreak began in mid-2014. A recent conference convened at the UN raised over $3 billion to help in the Ebola recovery efforts for Liberia, Guinea, and Sierra Leone. Nyeswa says that the turning point in the efforts against Ebola came after the 3 West African countries realized that they had to collaborate in the fight.
Even our colleagues in Guinea and Sierra Leone will work together very closely. Remember, at a certain point, we were approaching Ebola disease outbreak, the crisis as country crisis, individual country dealing with this situation. But at some time, our leaders came together and took head on this as a regional crisis, as a Mana River Union crisis. And with this, we worked together as a team. We knew very well that one country being Ebola-free was not enough to save the region.
He says that one of the main challenges early on was controlling the individuals and some institutions that claimed that they had a cure for Ebola.
What we knew in the health sector was that officially, internationally, there was no cure for Ebola. There was no known therapy. There was no known licensed vaccine by the World Health Organization. And so everybody coming in was bringing their own trial in terms of therapies and drugs to try it on Ebola patients. As a country, we did develop a treatment guidelines, put together and develop a guideline of how Ebola patients should be managed. We also, on compassionate ground, got the ZMAP and gave it to 3 to 4 Liberians that took that, but that was not a panacea of the disease. So we use traditional public health measures to contain the outbreak.
WHO says that while it is confident that Liberia has interrupted transmission, it is worried that outbreaks persist in neighboring countries of Guinea and Sierra Leone. It says that this situation creates a high risk that infected people may cross into Liberia over the region's porous borders. Nyeswa says that over the past year and a half, Liberians have continued to find ways to deal with Ebola in ways that minimize incidences of new infections.
It's the resiliency of the people. The people has gained knowledge over time, reaching from the community level to the political leadership of our country, including the president of Liberia, who has been engaging very well the people one-on-one in community groupings, meetings, and mobilizing the international community. including my team, the health team, the incident management system team of Liberia in the Ministry of Health, building strong alliances with our thematic group.
There were 5 confirmed cases of Ebola reported in the week ending 13th September, and they were all in Sierra Leone. Meanwhile, Guinea recorded its first Ebola-free week in over 12 months. For Voice of America, I'm Jackson Vunganyi.